This has been a fantastic year for breast implant health.
Oh, so tell us more. So I
Well,
spoke to Robin, and we've
yeah.
got we've got them on. Robin and Terry. They've done a presentation for the summit, and so they have updated us to the legislation approach to breast implant. So how what more do you know about that, Danny?
Oh, first of all, Robin and Terry, like I can almost not talk about them without just so much love and almost tears because they're just such um can I say badass on your on your summit? They're just such wonderful women
Yep.
that they're incredible. So what has happened, and really most recently, in October, the FDA, even before that, said that breast implants had a black box warning for all manufacturers, right? And in October, they mandated that not only is there a black box warning on this, which unfortunately only really the plastic surgeons know about or see. So our onus is to just make people aware that, hey, ask questions. But the FDA in October stated that they need to, meaning plastic surgeons and manufacturers, must give informed consent of what breast implants may or may not do, so that the whomever is receiving the implant is fully informed of the risk. And the risks are that there are man-made cancers specifically, but not only BIA, ALCL, which is a lymphoma, and then soon, and just recently, I'm going to not say his name correctly, but Jan Tervaart from the Netherlands, who now resides in Canada, wrote an article that will be coming out in its entirety called Breast Implant Illness Scientific Evidence. And so he uses the Bradford Hill criteria to diagnose, to formally diagnose. And so that's a big deal. And then also, I don't recall, I think we were just learning about something called silicone-induced granulomas within the breast implant capsule when we last talked. So Dr. Fleury, Dr. Eduardo Fleury, he's a PhD, MD, oncology radiologist with a breast specialty in Sao Paulo, Brazil. And he's just with a regular breast MRI, ideally it's with contrast because you can see more with contrast. And if you have any type of breast MRI with or without contrast, you can take a look. It's a special training that they have to have for the silicone-induced granuloma. If you have this silicone-induced granuloma, then you know you have an inflammatory cascade that your body has to deal with. And that's all that it means. It doesn't mean you have BII. It doesn't mean, you need to do all these things. It just means you have an inflammatory cascade. And in this breast cancer population, inflammation, oxidation is a big deal that we want to curtail. So if you happen to have this silicone-induced granuloma within the breast implant capsule, then it actually tells us, hey, let's think about this. Do you want to remove this implant? Do you want to remove this capsule as well? And no matter what data comes out in the next year, and I say this a little tongue in cheek, that capsule has to come out. It is an implant especially when you have silicone-induced granuloma, boom, the catcher's mitt, which is the capsule, means you're dealing with this throughout your body, right? And so how do we as practitioners help those with this inflammation? So removing the breast implant and the capsule is a big deal. Now, I hesitate to say this, but if this is a true marker, and I believe it is, I use it in my practice, this SIGBIC, and Dr. Fleury has been very generous with his time for my learning. I'm not the sharpest tool in the shed, but it's been a wonderful, wonderful year where I now use this for everyone who can get or obtain a breast MRI we will send the MRI, the DICOM files to Flurry. We're starting to train people in the US, and he'll train anybody, right? But radiologists don't yet know about this. It will come. It will come. Like it's a brilliant study and been validated. So
Wow. That is most excellent.
it
Most
really
excellent.
is. It's now objective findings, right? And then we have a regulatory body saying, hey, let's take a breath and look. And then we have, so Dr. Travart, and I apologize for saying his name that way, but he is a brilliant man. And he is someone who has already made, how do I say this? He's a MD, and he's from the Netherlands and now resides in Canada. And he's a immunologist, rheumatologist, and also specializes in Asia, which is adjuvant issues, and breast implant illness would be one of them, and as is the lymphoma as a man-made disease. So he, in his past life, identified something called vasculitis. And for the longest time, that wasn't even a diagnosis. And he was like, no, this is something we need to think about. And we need to be able to, the earlier we diagnose it, the more better, different treatment we can give the people. And so he used the Bradford Hill criteria to create the diagnosis of vasculitis, and that is now widely used in practice. And so he just did that with breast implant and breast implant illness, right? And so that said, that, you know, when you're a diabetic, it used to be like, I think when I was entering school, it was 140 was like, boom, that means you're a diabetic. But let's think about it. What happened here? You didn't go from 50, 60 to boom, 140 overnight, right? So there's going to be this gray area. And I think SIGBIC for me is the first manifestation of something is happening with this breast implant.
Danielle, I'm just going to interrupt. Can
Sure.
you just spell out the sick bit?
Oh, yes.
Yes, please.
So SIGBIC is wait, I got to write it out. So SIGBIC. So SIGBIC is silicone-induced granuloma within the breast implant capsule, right? Now, you can find silicone granulomas throughout the body. It's harder. And right now in this conversation, we're just talking about within that breast implant capsule. All I want to know is if you have breast implants, how can I help you? Right? It may or may not be the breast implants. More likely, so I'm going to digress a little bit. When you look at all the manufacturers' data sheet that's called SSED, which is the summary of safety effectiveness data sheet, they all submit to the FDA, and the FDA will read this SSED and put their stamp on it as this is why they've been approved. Like, with this data, we believe is true. And so within these, they talk about something called gel bleed. And when I was growing up in this realm, I thought gel bleed meant the gummy bears, the gel silicone, and gel is just the shell. Gel bleed, diffusion rates, openings, how the shell, it's all about making that shell as protective for you, whoever has the implant. It's all about trying to make that shell protective, and stuff still gets through. If you look at some of the explant, like there's so many physicians just doing explants right now that you can see their pictures of the en bloc or the capsulectomy, and you see these two different implants, left and right, and maybe the right happens to be discolored and the left is pristine, and you wonder what's the differences, right? So this is oxidative, this is gel bleed out and gel bleed in, and so we know that this occurs, and now we're learning that the changes of oxidation can really impact some people, and it's actually, in my opinion, the majority of people. It's just a matter of when, right? So this bleed occurs. but now we have things we can do about it. Now we have markers that we didn't have the last time we talked, and then we have strategies in which to open up the drainage pathways and help people. So, in fact, I know I'm talking a lot, but there was a wonderful woman who was watching your summit. And what was real, well, many wonderful women were. But what was interesting about this is she was just like, how can I find somebody where I live? And she happened to live in Charlotte, North Carolina, where I'm from. And so we got paired up, and it's been an interesting and wonderful journey with her. And she is someone who had SIGBIC, but because we can not shift, let me think about how to say this, because we can, I think practitioners can optimize one's health in this way. Your body's working overtime to protect you from this granuloma that we identified on SIGBIC. And when you give the body the materials it needs, you may obtain a percentage of vitality that you're happy with, right? So in this case, this is what we've done. And now with clear mind can choose whether or not to explant or do the things, especially when some people are dealing with young kids. I don't know what people's life choices are, but to be able to have them be healthy, to make an empowered, informed decision, I think we've come a long way.
Wow. Danielle, the word ameliorate comes to mind. And so ameliorate is one of those words used by in the medical world, where you've got something and you can just make it somewhat better. And so it's a great word because we don't actually know where it's going. We can't resolve things. So there's words that don't fit, but I really like the word ameliorate. It's hard to say and it's hard to spell, but I think it works.
Well, I just love that women are going to be informed. The sooner the better. And then if it is yes, now we have a marker to say, hey, now your total body's getting involved, or it's not. So enjoy until and then if you see it in what I know now, then you remove it. Whether you put another one in and still then do the surveillance, hey, that's great. We have choices now, and there's somewhat more better, different, leaning towards the healthy choice side, right? So
Danielle, talk to us about the lymphatic method, or what is this process that you've been working on?
So I love the lymph system and visceral, right? So it's not one alone, it's all of it. So if you can keep things moving, and what I'm learning is mainly through breath and the pressure systems, like even your head, your chest, your pelvis, all these different diaphragms, which we have at least 7 in the body. If we can keep those going, you can keep things pumping. And the lymphatic system is a passive system. It's unlike the arterial system or the venous system, where your heart does the pumping and the pushing. And I'm not excited. There's so much I can say about this system because I use it when I started to integrate osteopathy, lymphatics and osteopathy in my practice. People did better. They're doing better. And I don't necessarily, I have my thoughts on why, but especially in the women with breast implants, they do better. They obtain health and even clarity better. And so you think about the lymphatics, and in the lymphatic system, this area, which I believe you teach very well. Like you've
No,
I on don't. Your summit, no?
Oh, no. We don't have too many lymphatic people speaking on the summit because there's so many side effects. And so I'm just going to jump in. So you mentioned the word lymphatics. That's the lymphatics of the brain for the people
Yes.
that aren't sure. and all the lymphatics from the legs and the arms come back into the heart. So take over.
Oh, okay. So let me just take a breath because there's so much to say. So for me, and I'll keep it in this genre, and there's always two schools of thought. Do you move the lymph or do you not move the lymph for cancer? Stagnation for me breeds trouble. So I don't have to do lymphatic movement or visceral movement over the cancer site. So when I'm speaking lymphatic movement and I'm thinking even breath work or exercise like walking, I want to oxygenate the tissues, the cells, the constricted areas. And when we are in a state of tension, not just mental tension, but that happens too, postural tension, so many podcasts in one day, or working on the computer, or some of my clientele are people who have autoimmune issues. And we tend to, when our cells are not functioning properly, there's a vigilance those cells hold. And then that manifests in the body somewhere. And your weakest point is the one that is the one that has the pain, or like maybe it's the traps or the shoulders or the different things. And when we hold our body in such tension, the lymphatics can't move so easily. And so lymphatics, like nerves, like veins, like arteries, are everywhere. And they're all together, right? The lymphatics are in the nerve fibers in the lymphatics as arterial, as like, so one, that nothing works alone, and they're all together. So if you're uptight, like, so if you're in at a red light and you see someone cut through, then, everything's going to tighten, even all the sphincters. I'll just leave it at that, right? And then sometimes when you're in a state of inflammation, oxidation, overstressed, hypervigilance, you can't relax that sphincter, right? So I'm digressing a little bit, but these sphincters are everywhere in the body, and that affects your viscera. And this is your autonomic nervous system, sympathetic or parasympathetic. And then lymphatic, in my world, it gets ruled by the sympathetic nervous system, but should be run by the parasympathetic nervous system. So this thing of rest and digest is a big deal, especially in the cancer population. And congestion, where are you congested? So going to somebody who knows how to do visceral manipulation or osteopathic maneuvers or lymphatic drainage therapy allows you to give these congested areas opening and also some rest. And then you can flow. And I hope I did that a little bit of justice.
So Danielle, the what you made it very clear there is that the lymphatic system is an active system, and I say, and
it's actually a passive system.
Sorry. It's passive because of the way that it pumps through the body, but it's really active. It does a lot of work. It does a lot of work.
We haven't even, like, so in the lymphatic system, it not only is one of the ways we help carry out the toxins, but it brings the hormones to the places it needs to. It breaks down the fat, right? And in this population, we think about breast cancer and breast health and breast congestion. When we have surgery here, whether they removed everything or not, like the scar tissue should be pliable and movable. And if you have restriction, if you have physical restriction, then you most likely have lymphatic restriction, right? And what we want here is movement of nerves, of not all all the vessels and the lymphatics, right? And this is a very, at least historically, a very lymph / fat laden area for many reasons. And so we need to make sure we have lymphatic movement through here, even post-surgery. Um, the lymphatics, right? The drainage of the brain fog that happens with chemo, with breast implant illness, with lymphomas and the different things. Like some of it is because the circulation can't get out of the head and it gets stuck here. Wherever the door stops, the exit door of the movie theater, the one that's closed is where you can't get out, and that's where the congestion begins, right? Or if it goes from 2 lanes to a single lane, you'll get congestion. And managing that in flow, breath work, manual therapy. Some people who have had nodes removed need a bit more special attention and a gentler touch for sure. But there are ways to work around that area to also get it to flow. Yeah, and that's what we know today about the lymph. And I do think it has much more that it carries in. If you look up how the lymph goes through every endocrine system, right? It carries the hormones, it takes what it needs to bring, and it carries away what it doesn't need from that area, but it's constantly juggling the things. And if you have stagnation in one area, then it can't do what it needs to do. And we get this cascading effect on, like, okay, now we might have hormones. So then hormone issues, then the thyroid gets impacted, then your sex hormones get impacted. And, so we don't know what it is. So in my world, keeping that moving is paramount to health. And, if you have a lymphoma, I would move with caution, but I would breathe deep and hard and 360. And I would work that to bring the oxygenation into balance, really.
I'm just going to say something about that advice, and that is that it's crucial, but it's so easy for people to do the wrong thing for breathing. So, if you find that when you go to try and breathe and you feel like the shoulders are kind of like lifting up and you get exhausted, you're doing it wrong. And so there's therapists out there that breathing is their thing, and so
Yeah.
learning how to breathe is really important.
And if I thank you so much for that, because I'm one of them, if you will, that when I would exhale, or I would do simple breathe in for 4, hold for 2, exhale for 4, hold for 2, and I would have a panic attack, right? The deep breath in and the deep breath out, I'm going to say, I almost, until I just heard you say that, I almost said there's no wrong way to breathe, but you breathe and be aware of how, what I need. Let me just focus here, because I don't like telling people what to do. But when people would tell me, okay, exhale and lengthen the exhale, I would have a panic attack. And then that would be all wrong. But I could still take a breath and oxygenate my lungs and my legs, and with intention send it to my breasts and to do things post-surgery, right? And initially I would just breathe so it's comfortable. As long as I could breathe in and out. Sometimes it was fast, just like that. And now I can go and out. But that's about my max right now. So breathe, but breathe comfortable. Breathe like it's a hug to yourself. No matter what people are saying, 360, push it out the back, do the things, like, we'll get there. But for those of us who have been through physical trauma and emotional trauma, it is a challenge to breathe and get that balance back, but it's totally doable, and it doesn't have to be perfect. You just breathe. And so when I say it like that, I mean breathe within your comfort zone, and every now and then push it a little bit to see what you can do. And if you start to see that you're making yourself wrong about breathing, this is like, I don't know who we can have them call. You can certainly email me, but that's the spin I want to work on, because that's the Gabor Mate and the, the Peter Levine and Stephen Porges realm, that like, if we're picking apart ourselves for breathing incorrectly, then you know. Anyway, I digress.
No, no,
We
good,
digress.
good digress. Good digress. The I'm just wondering if we wrap it up. You had someone from the summit contact you. They were in your state, and I
Yeah,
just and how
city.
that's in your city. Um, what can you suggest would be something that I want to just go for two parts here. One, the therapist, and two, the person with the breast implant. What advice would you have for them right now?
So the easiest one is the woman with breast implants that is questioning, or even if you're not questioning and you just want to know your baseline. Now we have something called SIGVIC, which is the silicone-induced granuloma within the breast implant capsule that radiologists can identify. Where we are right now is that not all radiologists know about SIGVIC. So for those who are interested, connect with myself, or actually connect on the Breast Implant Health Summit page, and then we will get you to Dr. Eduardo Flore. And ideally, we would like to work with your radiologist in your town to learn how to do SIGVIC. And that's all it would cost, is that, like, let's pay it forward kind of thing, right? So for anyone with breast implants, reconstruction, augmentation, I think they should begin to ask for SIGVIC. And that's an easy one. If you have SIGVIC, then finding a practitioner that can help you optimize your path, your nutrition pathways, your digestion, your drainage pathways, your methylation pathways. That's the goal. And for me, that's usually an integrative health practitioner, a naturopath. And Australia has some phenomenal naturopaths, functional health, functional medicine practitioner, someone who can understand methylation in the Krebs cycle, right? So you can best use you if you, so then there's the next level of people who have maybe even explanted already, because they have all these things, and the majority do find wellness within that. Some don't, like, and you need to find an expert provider that understands how to deal with the different sensitivities, and start really moving things in a different way, with maybe a genetic patterning. And I think that if you are that population, reach out to the Breast Implant Health Summit, which is actually myself and Terry Diaz, right? And we will do our best to navigate you to where you need to be. If you are a practitioner that doesn't know but really wants to help, then again, within the Breast Implant Health Summit page or my email address, I will gladly, we will figure out how to teach that practitioner how to help that person. On the Breast Implant Health Summit page is a lot of resources from last year, which was 2020 was the last summit, and 2022 we'll have another summit, and it's going to be shorter but much more impactful. Not much more, I shouldn't say it like that. We have now diagnosis, and hopefully by that time we might even have a code and all this kind of stuff. So so anyone, I would say, let's funnel people through the Breast Implant Health Summit, because that's an educational resource, and we can move from there. That's how I work my practice. So anyone with breast implants, if you're questioning or you want more information, go to breastimplانthealthsummit.com or the Facebook page, or I think we have an Instagram thing too.
Fabulous. Congratulations, Danielle, to you and Terry for bringing about the summit. It's huge. That was a huge job. It was a huge summit, and making this information so available to people in the world. Good work.